just kind of get ourselves like situated for this next hour. So I'm going to take about 15 minutes just to share a couple of PowerPoint pages and kind of expand the lens of knowledge around cancer. Maybe just shine a little bit of a bigger lens on what is cancer-related fatigue, CRF. And then we'll take a moment and we'll move into practice. The practice will have a chair option and a mat option. And I'm just curious if anyone could, at least you can use that little hand raise or write in the chat if you would like the chair option. If the chair option is important, helps me get a sense. You can write chair in the chat. You can write mat, just so I get a sense of kind of where we are as a community. Great. Okay. Perfect. Thank you. This helps me a lot. So thank you all for putting comments in there. So I'm going to go ahead and just go into the presentation. My name is Miriam. I'm from Beloved Yoga, and I'm a trauma-informed yoga therapist and a yoga teacher. And I've been working with individuals on the journey with cancer throughout different phases of continuum for over 15 years. My first private client when I began was a client that was in the journey of remission. And that was my first introduction, and then moving on from there, I've been going forward. I'm part of the Society of Integrated Oncology. In September, there's a big conference. It's online and in Baltimore, and it's on living well with cancer. It may be an interesting organization to look into, and I'm presenting a workshop there on breath assessment and why that's important in cancer care. But we will have some of this speak today because it really relates to the cancer-related fatigue. So I'm going to share my screen. And let me do this. Perfect. And I just want to kind of lay out, we are on one page together. And you know, we don't always need a definition, especially when we're in the experience of it, but I feel it helps us have a sense. And I always want to hear if it resonates as well. And the Cleveland Clinic has a nice insight into it where it's not just being tired. It's like an overwhelming, almost paralyzing type of fatigue that it's like a no-go and you just want to stop. And it also manifests in different ways: sleep disruption, digestion disruption, but often it's an inability to engage in activity, and also mentally and emotionally fatigued. This is a part of the journey with cancer that sometimes we don't realize it until we're in it. And I wish earlier it was just spoken about, because there's things that we can do to take care of ourselves in this journey. And it's so individual for each of you. Each of us, that some of you will go through it a little bit, and some of you will be with you, and some of you it'll kind of move in and out, and some of you will disappear. It is very, very dependent on treatment. And so the cause is unknown because it's a multi-factor, but what it's showing is that it's related to treatment, surgery, chemotherapy, and radiation. And I want to just expand a lens on this. So every cell of your body has mitochondria. And mitochondria, like this is like an image of the cell, and there's like this big focus of this tiny, tiny part of it, which is the mitochondria, which has the DNA in it. And the mitochondria is basically, it's like the keeper of the cell's energy. The energy that emits from our cells comes from mitochondria. And there's a lot of interesting research of yoga as helping keeping the vitality of the mitochondria and the functionality of the mitochondria. So cancer-related fatigue, another lens to it is that it's seen as it's a dysfunction of the mitochondria, and this happens often because of treatments. But what's really important to remember is that there can be capacity to heal the mitochondria, to bring it back into a place of function. So although it may be dysfunctioning at some point, it absolutely has the capacity to potentially come back into a healthy function. But our fatigue kind of goes all the way back to this. Now, what impacts this well-functioning mitochondria? The number one kind of interruption is stress. And it's not just stress, like emotional stress, it's also toxin stress, it's environmental stress, it's the layers of that. Then there's diet, then there's sleep. And so it's multifactored. But what helps keep it really healthy, this has been two things that have shown to be really healthy to keep it optimal, is exercise and nutrition, appropriate and healthy nutrition and digestion. And I have this bullet here about other considerations, because sometimes it's medication that's impacting, it's hydration level that impacts nutrition. It's the emotional state that impacts stress, sleep imbalances, and also pain. I find that sometimes this conversation around cancer-related fatigue is also helpful to have the conversation around pain, because they can go together. Now, why yoga? And so I want to just kind of share that yoga has been proven in studies to be effective for supporting a better quality of life and improving energetic levels and supporting healthy mitochondria function. And I put a link, I'm going to share these slides so you can have access to the links, because this was a kind of a review of 17 studies, and there was 2,100, almost 2,200 patients, and there was almost equal control group. And the conclusion reached is that yoga can be considered as an alternative therapy. I would use the term complementary therapy for relieving fatigue. And this was particularly breast clients on the journey with breast cancer who have completed treatment or ongoing anti-cancer treatment. So it's in the phase of coming out of treatment. And just in case, I don't know everyone here, but if yoga is something new, let me offer at least a definition to collectively lay on. And the idea that it's an integrated practice that cultivates well-being through breath, movement, and contemplative practices. And we will explore a little bit of each. I will say that when we look at studies, when we see the efficacy of yoga, there is two things that's really important. One is that it is most effective when there is consistency. And it doesn't have to be every day. The particular studies that were most successful were the ones that was once or twice a week. So it wasn't like every day for 30 minutes. It was once or twice a week, 60 to 90 minutes over an extended period of time. And the practices that they had, because there's all kinds of yoga out there, was hatha based, as opposed to like hot flow, kind of really rapid, athletic, with breath work, contemplation, and restorative poses. And we'll do one restorative pose at the end of practice. And that's it. And we're going to go into the presentation, but into the practice. But I want to offer a little space to ask any questions, and just to know that a little a little becomes a lot. And to not feel overwhelmed, but to start with little practices. So today's practice, I'm hoping, will inspire that. But I want to just offer space if there's any questions. I also would love in the chat to know how many of you are actively dealing with cancer-related fatigue. You can just say yes in the chat. You can raise your hand. You can unmute. If you're comfortable to be on video, it's always nice to maybe see each other at some point, but do what is coming. But I'd like to get a sense of how many of you are in the journey with CRF.
Hello, I am.
Hi.
Hi.
I'm Mary Ellen.
Hi.
Thank you.
I'm halfway through radiation. So
okay. And you have what, several more weeks? What is your
3 more weeks to go.
Okay.
Doing well.
That's wonderful. And you're feeling the effects of fatigue?
A little bit.
Okay.
A little bit.
Okay. And so that's wonderful. So trying to kind of get a hold of it. Perfect.
Thank you.
Thank you. And then Sharon, you shared significantly, and I'm just curious where you are in the continuum. Are you in treatment, post-treatment? You want to write that if you're comfortable. It does help. And often this sets in more actively post-treatment, that it's always unique to the individual. Okay. And Izzy, are you experiencing it already? The fatigue, or you're wanting to kind of have your tools ready? Okay, I'm going to assume that because you're just starting, it may not have settled in. Okay. Thank you. Thank you. This helps. This gives me just a sense. So let's dive into, and thank you for sharing, because it gives us an idea of the range of experience. And there's a medication, there's radiation, there's the effects it has throughout the body and the brain. And when you say the brain, I also think of the nervous system as part of our central nervous system. So all of this is absolutely affected on this journey. And just know that there's so much hope around bringing in practices into your life to support and to build just back to that, even that little mitochondria that's nestled in every cell, to help the energize, to have energy for our quality of life. So let us begin with the practice. So joint pain, the sleep disturbances, thank you for bringing this up. When to do the practice is a very personal conversation, because it's different for each person. And it's hard to sometimes engage in the practice when you're very fatigued at the end of the day. However, if there has been no movement, this is why exercise helps the mitochondria function. If there's been a very little movement and you're going into sleep, this is why having some type of movement practice before sleep can help rest more effectively, more well. So let's go into the practice, and I have a chair, and we're gonna do it's a standing sequence, and then we come back down and I'll give the chair option. So Let's actually, we're going to start standing. I think that's going to be the best thing. And you can have your chair nearby, if you prefer. If standing is, you're going to get challenged with just standing for so long, then I'm going to give you this option of being in the chair, but I'm going to demo both. So we're going to, if collectively we can start standing, would be great. Or if you prefer, just start seated in this configuration. So let's just take a moment. I want to just get into the body movement and then and the breath will be a part of it. And you're going to take a comfortable distance that's not so wide, that doesn't compromise your sense of safety. You'll notice in this sequence, I'm opening up around the arms, a lot of arm movement, which helps oxygenation, helps the respiratory, and helps emotional depression, stress. We may kind of hold it in this part, so this is to also circulate. So finding that comfortable distance, this is called star pose. It's one of the names. You can think of your own name, but I'm going to call it star pose. And as we exhale, gently lower the arms down by your side. As we inhale, I'm going to have you lift the arms, turn the palms up, and soften the elbows. Exhale, turn the palms down by your side. So just getting into this rhythm. So the inhale, the exhale. I think I just reversed that breath for you. So let's start from the top. So we're all in sync. So this is the inhale, the palms face up, the elbows. This is the exhale, the arms come down. And just do this 2 more times. This is the inhale. And this is the exhale. So now I'm going to add on. This type of coordination is really good for the brain, but it can be to just move with kindness through this. So as the arms go up, your heels come in and you bend the knees. This is the inhale. As you exhale, the arms come down, the heels move out. Inhale to the full body integration. Exhale. And just, we're going to repeat this 5 times. And if you want to be in your chair, it would be an inhale. And then you would turn the feet in as the hands come down. Exhale. And exhale. 1 more time. So whether you're seated or standing, arms are down, toes are turned in. Now gently turn the toes out and the heels in. And as we inhale, we're going to sweep the left arm across to the right and then release. And just let it be natural breath. Go to the opposite side. Sometimes it's an inhale, exhale, inhale, exhale. And just continue just a few more. Fluid, a flow. There's going to be the style that I'm doing today is more what's often known as Vinyasa yoga or just classic yoga. It's a repetition hold style. I'm just demoing both and just continue. Like you're pumping, moving the lymphatic fluid. Perfect. 1 more time. Excellent. And we'll come to standing and heel toe the feet together. And gently just take a fold. You can come down halfway, elbows to thighs. If you have a chair, you can use the chair. You can also fold forward all the way, touching the feet, letting the head release. So find your appropriate forward fold. Maybe open the mouth and release the breath, letting the head and neck soften.
And let's not come up all the way. Come up halfway so you have a moment of pause. Hands would come to the thighs and a little pause. And then slowly come up. Now we open back out to the side. And if you want to stand next to the chair would be perfect. And you're going to turn the right foot. I'm going to mirror you. And the left toes slightly turn in and the heel comes out. So because when we're dealing with cancer-related the fatigue, it's in us. And think of you are your own regulator. So you might know Warrior Two as this open pose, but we're going to keep one arm down. Your left arm stays down. Bending the right knee. Inhale, lift the right arm as high as you're comfortable. And then exhale and release. And we'll just repeat this 4 times. Natural breath, let it be what it needs to be. Doesn't have to be one breath to movement. Arm goes as high or as low as it honors you. Perfect. And this next time, bending the front knee, the inhale, the arm lifts. Remember, it can go where you want it to go. The left arm is relaxed, the right arm is lifted, and feel this elongation of the right side. If it's appropriate, begin a little lateral bend. Just open up along the right side. And then we're going to lengthen the right leg and lower the right arm. Now we're going to bend the right knee, right elbow to right thigh. Notice the left arm is relaxed. You can even wrap it around or hold the hip. This one will be a little bit different. So now you inhale and you lengthen. The right hand just rests against the leg. And then you exhale and bend into the knee, elbow to thigh. And just continue 4 more. One of the reasons why exercise is helpful, movement, especially like we're doing right now with some load, is it builds muscle. And muscle, healthy muscle tone, let's rest here for a moment. You can always rest your hand against the thigh or elbow. Muscle tone also helps functioning healthy mitochondria. Energy. Just one more breath. When you feel a little load, muscles, the legs are working, then slowly rise up. Pivot the toes in. If you have the chair and you want to use it, you can use the back of the chair. So I'm going to just orientate myself so you can see me. And you can hold the back of the chair as you fold forward or forearms to the chair. And also take your hands to the seat. And you can also bring the hands down to the ground. Give the back leg line a nice length. Let the head and neck release. Soft bend of the knees. No need to have this idea of straight legs. The breath is moving in and out. And notice as you exhale that maybe you can hug in the muscles of the core. And then as you inhale, you can open up. And then as we come up, we think about pausing halfway. If you're not using a chair, hands can come to the hips, soft bend of the knees. And then slowly lift. Now we'll do the other side. But before we do the other side, heel, toe, the feet together. And just loosen up, kind of be a little bit organic. Move as needed. Perfect. And then we take the feet wide again. This time we do the other side. So the left foot's going to turn, which orientates this right knee towards the direction of the toe, and the left leg. And then the right toes turn in. So you've got this angle, right? So you're not perfectly turning your hips to the side. And it's okay if the torso is on this angle too. Okay, if you know these kind of the classics, sometimes we turn the rib cage and we keep the hips, but
let the whole body be orientated that way. Right arm releases. As we inhale, bend into the left knee, left arm lifts. And exhale, release. Taking a few, about 3 more rounds. Being with your breath, letting the mind focus. Might be challenging, just bring the mind back to the breath. And then the next time we're going to stay. Bending this left knee, feeling it over the heel, feel your heels pressing down. Arm reaching as in the direction that's best for you. Maybe explore a little lateral bend. Just enough, creating space at the left hip joint, left side of the ribs, under the left arm. Circulation. And then we slowly release the arm and lengthen the leg. And then we're going to bend the left knee again, bring the left elbow to the left thigh. Remember, the right arm can rest, hold the hip or wrap. And this time, both feet, you're pressing into the ground. You lengthen the leg, the arm comes down. And bend into the knee, place the elbow, and then lengthen. Excellent. Lengthen. Coming in and out. Very nice. And then this time, I'm just gonna stay here for a moment, feeling the strength of the legs, the loading. Feel both feet pressing down, reach into the heels. Sometimes it's hard to feel the feet to the ground. Press the bone, center bone of the heel down. Okay, yes. And then we lengthen, and we come up, hands to hips, and we turn the toes in again. And then you can use the back of the chair. You can let your hands slide down, hands underneath the shoulders, or you're using the chair as support as needed. Lengthen that lower back a little bit, maybe a little bend of the knees. Head releases. So from here, I'd like you to bend or using a chair, come up halfway, take a moment, feel your head is higher than your heart and your heart is higher than the hips, and then gently press into the mat as you come up. Okay. Heel toe the feet back together. So in this next part, as we come down, I would love everyone to have a chair, but if you don't, or maybe if you're near a couch and you want to use the couch, you can use the couch. If you don't have a chair, no problem. But I'd like to share constructive rest. But before that, we're going to do just a little bit of some seated work. And you can use the chair to come down. I'm going to have all of you just meet me on the ground into a simple, your version of seated that is best for you. And maybe the legs out or one leg is in. And we're going to orientate ourselves to be on to the back. And then we'll go through a little exploration. Now, you can lay on your back and keep your feet on the ground. But if you have the chair, bring the calves onto the chair and make sure the chair is not on a slippery surface, and feel that your knees are over your hips. And if you don't have a chair, your feet are on the ground. Now exhale and gently draw the right knee in towards the right shoulder and open up this right knee. And then as you hold the knee, circle the knee around.
Breath is moving. Perfect. And then keep the knee open gently. Think of the knee moving towards the right shoulder. Little compression of the right hip joint. Okay. And then place the right ankle on the left thigh. Remember, the left foot can be on the ground or the chair. And you're just going to draw the knee in. And as you exhale, feel that whole left thigh externally rotate, keep the foot flexed. And just do this 3 times. So there's 2 types of joint movement that is important for our well-being. And one, there's load, there's stress, it's a type of stress, right? And the other one is there's no load, and it's sometimes called mobilization or traction. So now let's bring this right leg to the sky and bend and lengthen. It's like a little love for the knee. And you can hold the back of the thigh, point flex, and circle the ankle. Spread the toes. Very nice. And then gently lower the right foot on the ground or the right thigh onto the chair. Bring the left knee in. Left hand can just be on the left knee and just circle the left knee around. The left foot can be relaxed. Just a little circling around. And then gently bring that left knee towards the left shoulder. And hold underneath the shin or the back of the thigh. And just allow this left knee to relax, relaxing the left hip. Try to soften tension off the jaw or shoulders. Remember, please, if you need any support under your head, please use a blanket or a pillow. Excellent. And then bring that left ankle on the right thigh. Foot is flexed. And then we move this knee in and out. You're really just moving this hip joint without load, lubricating. Treatments that help us release the cancer. It does, the body gets dry. It just has a little, it has, not a little, it has an effect. But just know that there's tools you can use to help mitigate. And gently draw the left knee back in and lengthen the leg and then bend. So this drying feeling, this pain that can be in the joints. I mean, I just, every time, and then lengthen the leg and point and flex. I think I've heard it more recently than before in working with individuals, just that the sharing of, I didn't know my body was going to be so different. It was going to feel so different, that it would never be the same. And this is that, just the journey to be present, to have this medicine. There is this effect, and then to learn, what can I do in the self-care? Because that makes a huge difference. So gently hug in and lower. So both feet can be on the mat or calves on the chair. And I'm just going to show you with the feet on the mat, because you want to keep the knees comfortable, feet not too wide. Maybe rest your hands on the hips just to keep the lower body as relaxed as possible. What the chair does, or the back of the couch, is it really softens the psoas and the digestive system and all the lymph nodes. But taking a moment, be comfortable. Set yourself up to be as comfortable as
possible. Use a blanket under your head. Use anything you need to be more comfortable. I'm gonna sit up just to guide, but please stay where you are to be comfortable. And take your awareness into the lower ribs, the lower rib region. And notice as you breathe, if you can be more aware of the movement in the lower ribs. And if you have your hands there, you might notice as you inhale, the tips of the fingers move away. And as you exhale, the tips of the fingers draw towards each other. Or you might just notice the natural expansion and then relaxation. If you're noticing the reverse, this can be common. A reverse breather is when the diaphragm is doing the opposite, and you can self-correct that with cultivation of breath practices. So it might be taking a little bit of effort, but notice the expansion on the inhale and that settling on the exhale. Gently extend the arms out in any way you would like. Maybe out, maybe palms down, maybe above your head. Maybe like a T. Maybe the arms are doing different things. Just orientate your arms in a way that they're restful and there's a sense of openness under the arms, around the upper chest. Just an absolute place of rest. I'm going to invite a counting of our breaths. We're going to count backwards from 15 to 0. I will start the first few and then let you go. And then we'll spend a little bit of time. And this is a really nice way to quiet the mind. And you might find your breath slows down. And if you lose your place, just start over. It's all good. So as you're relaxed, in your mind's eye, maybe see the number 15. The inhale will be the odd numbers. The exhale will be the even numbers. And to yourself, silently, as you inhale, say 15. Maybe in the language that's more comfortable for you as well. And then as you exhale, inhale 13, exhale 12. Inhale 11, exhale 10. And just count your way back to 0, counting to yourselves. Whenever you get to 0, just remain there. And begin to deepen the breath. It's a little effortful, and we'll do a pursed lift exhale. So inhale through the nose. Pursed lift exhale like you're blowing out a candle. Inhaling. Just with the exhale. And just one more time, bringing your attention back to your breath. And then wherever you are, consider gently reaching the arms overhead or out, maybe a little more like you're stretching out the upper body. And whenever you feel comfortable, draw the knees back in, arms come around the legs. And then you can gently let the knees go to one side and maybe roll onto that side. Maybe make a little pillow with your hands. And then take your time to roll on the other side. So you can come back, hug the knees in, and then roll onto the other side. Make a little pillow. And just stay there a few breaths. And then from that side, gently come up, seated, helping yourself up gently. And if you prefer to sit on the chair, please do. You can also stay seated on the ground in a way that's best. Really encourage that you sit on a pillow or a bolster or a blanket if you're sitting on the ground, and just think of just a comfortable seated pose for yourself. So whether in the chair or on the ground, we'll do a little bit of a mudra. And mudras are gestures that are with the eyes, with the face, with the body, and also with the hands. And you're going to bring the tips of the fingers to meet one another right in front of the center of the chest. And you can look into this space that's in between the hands. And as we inhale, you're going to reach the arms out, but also press them down. With the inhale. And then as you exhale, you draw everything back and you bring the tips of the fingers to meet, watching it as maybe it lifts up a little bit. And we'll just do this about 5 times. Try to look down, the hands kind of disappear into the periphery and then they come back and you see them, fingertips meeting each other. Try to have the gaze down where your upper back doesn't need to over-round. Keep the spine lifted. And as you exhale and you release the breath, feel that diaphragm, it's right at the bottom of the ribs, lift up very naturally. And then this last time, keep the fingertips together. Press them actively against each other. And just stay in this active engagement for about 3 breaths. Nice. Then interlace the hands, press forward, gently round. And then lift up the arms and then gently open the hands, twisting to the right. So the left hand to the right leg, right hand behind you. Gentle rotation. If you're in the chair, you can use the back of the chair as a place to rest the arm. And then come back to center. Interlace once again. Press forward and round. And then lift up and then release as you twist to the left side. And then gently come back to center. Then we'll do a little bit of a vagal reset. It's more of a ventral vagal reset, which is part of your vagus nerve that's in the upper body. And then the dorsal vagal is the part of the vagus nerve that's in the lower body. And the vagus nerve manages the responses that are from the parasympathetic system, which is also related to your rest and digest. It helps counter stress in our lives. Stress that we don't want to hold on to. We need some stress, but we don't need it all. So, and it's quite simple. What the efficacy comes from a couple things. One is to hold for at least 30 seconds and then working on the eye movements. So I'm going to show you what it is. So just again, comfortably in the chair or on your mat, you're going to inhale and let the head gently bow forward, and then take the left ear to the left shoulder. And you're going to stay here. If you're comfortable, you're going to take the left hand on the outside of the head and just very gently put a little bit of pressure there. So you can feel there's a sensation from the back of the ear down to the collarbone and even to the shoulder. This is the big muscle, the sternocleidomastoid muscle. And without moving your head, just let your eyes drift towards the ceiling. Without turning your head, just the eyes. Remember, you don't need to have your left hand there. Maybe you prefer the left hand resting onto the leg. One more inhale that lifts up the sternum. And then we exhale and we let the head bow forward. Then right ear leans to the right shoulder. And maybe the right hand gently rests against the outer skull. Exploring the sensation from the back of the ear. This is also where part of the vagus nerve feeds into the face. It comes down. So right in the left vagus nerve comes down. Remember, you can always rest your right hand down if that's not ideal. And then let your eyes just drift to the ceiling like you're trying to look up, but you're not going to turn your head. Maybe notice there's a little saliva. Maybe notice the need you have to take a deep breath. Just these beautiful signals that when the vagus nerve is stimulated, these are some of the signs. We want to breathe. Sometimes we sigh as a response to yourself. Slowly release the hand, let the head bow forward, maybe close the eyes and gently lift up. And then taking the hands and rubbing them together until they're warm. And you don't have to place the hands on the eyes, but just gently maybe cover the eyes enough so that it feels a little bit of darkness. So the eyelids, the light isn't coming into the eyelids, but you don't have to place your hands on your face if you're not comfortable. Just let it hover. And then let the hands come to the temples, a little massage of the temples. Come down to the jaw, a jaw hinge. Feel your lower jaw relax. So when we're cellularly trying to rebuild ourselves, and post-treatment and also in treatment, keeping ourselves as healthy as possible, we have to have tools of how to manage the stress, how to tension. And sometimes we clench our jaw without knowing, and there's a band of muscle. And so you're just helping this band release, which may help the jaw relax. And then lower the hands down to the ground or to rest onto your lap. Just come back. You can have the eyes closed or open And just do a little check-in with yourself. Just gently check in. And maybe just ask yourself, how are you? How are you feeling right now? And consider one takeaway, one thing that you feel like you can take from this practice, you can bring into your daily life. It's an idea, something you've never thought about. Maybe it's actually a specific practice, a movement, a breath. Gently take a moment and bring your hands to the ground on either side and just touch the earth. Kind of open the eyes and look around in the space that you're in. Look up, look down. If you have a window, look out. See kind of what's the furthest point your eyes can go to for a moment. And then on the inhale, we reach the arms up halfway. This time as we exhale, the elbows soften and the hands meet in the center. Of appreciation and gratitude. Namaha, namaste. So take a moment, get some water,